Minutes after the hour of 2 o'clock. Welcome on this day, the 2nd of July, this year 2021. My name is Jagenda Semakola Zeksoka. Once again, back at it as the country Uganda endures the second wave of COVID-19. Now, as we climax the first third of a 42-day lockdown, we're very glad and honored today to have and host the Minister of Health to talk to the nation and, of course, to tell the world of Uganda what we're doing about the response on the COVID-19 pandemic that we continue to struggle and battle with. You're very welcome, Honorable Minister. But just before you address us, I just want to let you know that there are members of the press here from different media houses who would love to respond to your statement after delivering it to us. I now welcome you and ask that as you speak to us, help us introduce the panel and the team that you've come along with on this day. You're very welcome, Honorable Dr. Jane Ruth Acheng Ochero.
Thank you very much, Mr. Jagenda, and thank you for welcoming us here to share with the nation on issues regarding COVID-19 this afternoon. I will start with the introductions as you have requested. I am extremely happy this afternoon that I have been accompanied by my colleague, the Minister of State for General Duties, Honorable Anifa Kawoya Banjirana, who is on my left-hand side.
Good afternoon, our listeners and members of the press.
And on my right-hand side, I have Dr. Jonas Tegeny, who is the country representative of the World Health Organization. And next to him is Professor David Seruwada, who is the chair of the Vaccine Advisory Committee. We also have people who are here with us, though not sitting here on the panel. They are seated on the other side. We have the Permanent Secretary, Ministry of Health, Dr. Diana Twine, and immediately behind her is the chair of the Scientific Advisory Committee, Dr. Misachi Wayengera. We also have Dr. Charles Solaro, the Director, Clinical Services. And accompanying us is also the chairperson of the Private Healthcare Federation, Dr. Grace Sally, who is seated just in front of Dr. Olaro. We also have technical teams who have accompanied us. We have the program manager for the vaccination program, Dr. Alfred Riwale, and also the project coordinator of Gavi, Jimmy Ameny. Of course, I have my public relations officers, Ineviona Emmanuel and Abirami Kananathan, and my personal assistant. So those are the teams, and we'll be able to respond to the questions as they come. I'll now request that you allow me to go straight to my statement.
You're welcome, and please do that.
Thank you. So the Ministry of Health would like to update the public on the second wave of the COVID-19 pandemic in the country and the ongoing vaccination program. The country has registered 82,082 confirmed cases of COVID-19, 54,158 recoveries, and 1,127 deaths, bringing the case fatality rate to 1.4%. We continue praying that the souls of the departed rest in eternal peace, and that God continues to comfort the grieving families in this difficult time. Currently, there are 1,086 COVID-19 patients admitted in both public and private health facilities. Of all the confirmed cases, 41,711 cases, representing 51%, have happened in a duration of 3 months of the resurgence. Over the last 3 weeks, reports received show that all the districts are affected. However, the districts with the highest attack rates are Kampala, Gulu, Mbarara, Mpigi, Luero, Chotera, Kalungu, Masaka, Jinja, Tororo, Kalaki, Wakiso, Kiriandongo, Soroti, Nebi, Moyo, Ajumani, Butaleja, Hoima, Amuru, Iganga, Budaka, Sironko, Busia, and Mbale. These have the highest attack rates. Kampala metropolitan area accounts for 50% of the national case count, consistently contributing to the biggest percentage since the start of the outbreak. Unlike in the first wave, where most of severe and critical cases were above the age of 60 years, the second wave is, however, characterized by a shift to high number of cases among the age group below 40 years, and many ending up with unfavorable clinical outcomes. In April and May 2021, admissions ranged between 10 to 20 new cases daily. This is now drastically risen to an average of 120 cases daily. The majority of those admitted are severe cases in high dependency units and critical cases in intensive care units. This has exponentially increased the oxygen requirements, with each COVID-19 patient consuming 4 to 6 cylinders per day, as opposed to 1 to 2 cylinders per day for the non-COVID patients. As communicated previously, genomic sequencing continues at the Uganda Virus Research Institute. As part of this surveillance, we have noted the emergence and entry of different variants, including the Delta variant initially identified in India, that is referred to as the B.1.617.1 into the country. And as Ugandans are aware, we have 5 variants in the country. We have the Alpha variant, whose country of origin was the United Kingdom, and we confirmed it on the 2nd of February 2021. Then we have the Beta variant from South Africa, also confirmed on 2nd February 2021. And we also confirmed the Delta variant from India first on the 15th of April 2021. However, there are other variants of interest that include the Eta variant from Nigeria, confirmed on the 3rd of February, and the emergence of a new variant in Uganda that was confirmed in June 2020, and it is the A.23.1. Analysis made for some of the samples collected from Kampala and Wakiso between the 3rd and 15th of June 2021 indicates that the predominant strain currently in Uganda is the Delta variant. That is the variant from India. From our observations, we have noted increased transmissibility, resulting in a fast-moving outbreak, more severe clinical presentations of new cases, and unfortunately, resulting in poor clinical outcomes. The second wave, therefore, is driven by the presence of the Delta variant. Evidence from other clinical settings indicates that the increase in transmission appears 2 to 3 months after the introduction of a variant into the community. In India, the emergence of the Delta variant in September 2020 was followed by an upsurge in cases and deaths in December 2020 to May 2021. So this was a period of 3 months the same as happened in Uganda when we first reported the presence of the Delta variant in April 2021. In addition to the presence of the variants, adherence to the standard operating procedures was largely poor. The population continued to mix without observing standard operating procedures at household level, while under home-based care, in public transport, places of worship, workplaces, burials, weddings, and celebrations, and other cultural events. Bars were operating illegally, and also there was mixing in complex social networks. In addition, schools were a major driver of the community spread. These factors were a significant factor that informed the directives of His Excellency the President. So I'll now speak about the lockdown and what we intend to achieve. On the 6th of June 2021, His Excellency the President announced new measures to curb the second wave. The measures were intended to decongregate the infected and the susceptible individuals to deny the virus a chance to propagate. Evidence from other settings shows that lockdowns slow down and reverses the transmission. Given the long incubation period of the virus, the effects of the current lockdown may be seen after 3 to 4 weeks. According to our scientists, the country will most likely reach the peak of the daily number of cases between the end of July 2021 and August 2021, before we start registering a gentle drop in cases. In the 42 days of the lockdown, the Ministry of Health intends to maximize the opportunity to do the following. 1, enhance measures to interrupt transmission of COVID-19 among healthcare workers and the general population. 2, enhance risk communication and community engagement. 3, streamline and strengthen home-based care for COVID-19 mild and moderate cases. 4, increase the capacity of our health facilities to optimally manage COVID-19 cases. 5, continue with vaccination depending on availability of vaccines. 6, sustain continuity of essential health services. And 7, smoothen the access to medical emergency services. Reporting on COVID-19 deaths. As you would recall, the public was informed that we have observed deaths from unconfirmed cases that were subjected to investigation to ascertain if they are due to COVID-19. The Ministry of Health, working with the COVID-19 Scientific Advisory Committee, has finalized a clinical diagnostic criteria for suspected COVID-19 deaths, but with no PCR or antigen rapid diagnostic test result, or with a negative test result, but with a clinical picture similar to COVID-19. Therefore, COVID-19 deaths will be reported in real time as PCR or antigen RDT confirmed or probable COVID-19 deaths. So the reports will cover the 3 areas: PCR confirmed, antigen RDT confirmed, or probable COVID-19 deaths. Based on the above, the harmonized death count currently stands at 1,873 deaths, bringing the case fatality rate to 2.3%. Of these deaths, 1,127 were PCR confirmed, while another 746 are deaths confirmed clinically as probably due to COVID-19. And so our statistics will now be capturing the numbers including the probable deaths, and the numbers now stand at 1,873. I'll now talk about prescriptions and guidelines for COVID-19. The Ministry of Health has observed rampant use of drugs by the population due to fear of COVID-19 infection. Drugs are being bought off the counter and taken by the population believing that they are treating COVID-19. The Ministry of Health, with support from the case management specialists, developed national guidelines for the management of COVID-19 disease and expects this to be used in all facilities that are managing patients with COVID-19. The guidelines cover for mild, moderate, severe, and critical cases of COVID-19. The management of COVID-19 is mainly symptomatic and supportive. Drugs administered to patients with COVID-19 are intended to alleviate symptoms and support the body to combat the disease. Different drugs are given according to the presentation and clinical assessment of the patient by the health workers. I'll bring to light some of the drugs and the side effects. And we'll start with paracetamol or acetaminophen, also known as Panadol. This is indicated for high temperatures or fever. It should be avoided in patients with liver disease as it can worsen the damage to the liver. Therefore, it should be taken on prescription. The second is the vitamin A, vitamin C, vitamin D, and zinc. Many of you will note that vitamin C has fallen out of our prescription list, and therefore we will not talk about it. The rest, vitamin A, vitamin D, and zinc, support the body to build immunity to fight COVID-19. Taking too much of these can cause nausea, diarrhea, and stomach cramps. And therefore we advise that they are limited to prescription by the health workers. The third is the antibiotics, azithromycin and amoxicillin. These are reserved for those who present with moderate disease, especially those with signs of pneumonia, with no need for oxygen, and they should be used cautiously. Reckless use, as in self-medication, will contribute to antibiotic resistance. Antibiotics have no added advantage on the mild and asymptomatic cases, and the public is requested to desist from procuring these drugs off the counter and taking them without guidance from a medical practitioner. The intravenous or injectable forms of the drugs are indicated for patients with severe disease or critical patients and should only be administered to patients in hospital under the supervision of medical personnel. Steroids, and in this case we are talking about dexamethasone. We have noticed many people who were infected with COVID-19 and have been under home-based care presenting with side effects such as high blood glucose and increase in weight from use of this steroid. Dexamethasone is only indicated in patients with severe COVID-19 and should only be given by a health professional. Prolonged misuse in other cases in the absence of a health worker to monitor the patient may lead to serious skin, brain, and hormonal side effects. Therefore, we caution the public to leave the prescription of this medicine to health workers. Oxygen. The ministry has also observed unregulated use of oxygen at home and in vehicles. Oxygen should only be given to patients admitted to hospitals under the guidance of a professional health worker. Aware that due to fear, many people may have procured pulse oximeters to monitor their oxygen levels, the Ministry of Health advises that COVID-19 patients with blood oxygen levels below 92% should report to hospitals for assessment and further management. Unregulated use of oxygen may cause damage to our lungs, so avoid it. We'll later on speak at length about use of oxygen at home. The next is specialized drugs such as Clexane and others like heparin should be avoided. This is indicated for patients with severe COVID-19, and if misused can cause bleeding which can be deadly. Use of other drugs such as colchicine, remdesivir, ivermectin, and other investigational and repurposed drugs is still under study by the Ugandan scientists. The ministry strongly discourages use of these drugs outside research or investigational settings. We'll now talk about burial of people who have succumbed to COVID-19. The Ministry of Health developed guidelines for handling of bodies of persons that have passed on due to COVID-19 with guidance from the World Health Organization. The guidance outlines the process of safe handling of bodies of persons that have died both at the health facility and in the community. The body of the deceased should be put in a body bag and then placed inside a coffin and handed over to the family members for safe burial. Family members are advised not to tamper with the body bags or desire to touch the body at any time, and strictly adhere to all the COVID-19 standard operating procedures while conducting the burial. As per the President's directives, the general public is reminded to limit burials to only family members, and in any case not more than 20 people. We'll now talk about expansion of testing capacity by use of COVID-19 antigen RDTs. The Ministry of Health commenced the use of antigen RDTs in November 2020 in 30 priority districts as a pilot to inform the scale-up. Currently, the Ministry of Health has distributed RDTs to all the national referral hospitals, regional referral hospitals, district hospitals, health center 3s and 4s, Uganda Prison Services, isolation centers, and non-traditional treatment facilities like Nambole. Our guidelines require use of the antigen RDTs in patients presenting with COVID-19-like symptoms only. RDTs should not be used for screening of asymptomatic people, so please ensure adherence to these guidelines when using these RDTs. And this information is particularly given to all those who are currently using the RDTs. To scale up testing, we have also initiated outreach testing camps using antigen RDTs to increase access and reduce the volume of samples referred to the central laboratories. In Kampala metropolitan area, 25 sites have been set up, and a similar approach is encouraged in the different districts across the country. So far, only 2 RDT brands have been approved for use in the country, and these include the COVID-19 Abbott PanBio and the Standard Q. So we request all health providers to strictly use these particular brands which are readily available on the market. They have been validated by our laboratories and allowed for use. So we'll go back to the issue of oxygen needs for the country. The Ministry of Health is aware of the need to scale up access to medical oxygen across the country. Great strides have been made with the establishment of oxygen plants at all the national and regional referral hospitals across the country, whose capacity was adequate for the non-COVID-19 oxygen requirements. The average daily oxygen consumption for the high dependency units and the intensive care unit patients is dictated by delivery pressure and volume. Each COVID-19 patient consumes 4 to 6 cylinders per day, as opposed to 1 to 2 cylinders per day for the non-COVID-19 patients. The very high oxygen requirements remains a main constraint to expanding bed capacity. Currently, private oxygen manufacturing plants, including Roofings Limited, Oxygas, Steel and Tube, BM Steel Mbarara, NEC, Tembo Steel, Uganda Oxygen Limited, Mayuge Steel, Pramuk Steel Limited are supporting filling of oxygen cylinders to supplement the oxygen requirements of the COVID-19 patients. Apart from Oxygas and NEC, the rest have been supplying oxygen free of charge. The Ministry of Health deeply appreciates this gesture from the private sector. The ministry will in the immediate term secure more cylinders to quickly bridge the gap. Install more 6 oxygen plants in various regional referral facilities and one of a bigger capacity in Mulago Hospital. Consideration is underway for liquid oxygen to address the large volume of oxygen required. Use of oxygen at home. The Ministry of Health has noted with great concern that a number of people continue to administer oxygen to COVID-19 patients within the confines of their homes and many other ungazetted places, a practice that could be harmful to the patient. In a number of countries, such use has resulted in medical complications to the patient, explosions and fires leading to loss of lives. This haphazard oxygen administration has resulted in harm to patients by the time they are linked to care at health facilities. The damage is beyond repair, and such patients have proven difficult for the health workers to save them from what could have been easily prevented. The public should note that use of oxygen at home is very dangerous to the lives of their patients and the entire household, where such administration is taking place because of the following reasons. 1, a COVID patient who requires oxygen has severe or critical illness. Such cases should be managed in hospitals, not at home, where oxygen requirements can be regulated by the health workers, who will also be able to handle the patient holistically without missing other disease conditions. 2, unregulated oxygen may be administered in unnecessary high doses or levels, which is toxic to severe vital body organs such as the brain. 3, due to lack of proper monitoring, a number of patients are deteriorating because of receiving either lower or higher oxygen doses at different severity levels, as different severity levels may demand. 4, families may not know whether the oxygen being used is medical grade oxygen or industrial grade oxygen. Industrial grade oxygen is not optimally useful to the patients, and a number of known severe side effects are associated with it. 5, not every COVID-19 positive patient requires oxygen therapy. And 6, oxygen is highly flammable. Its improper use and management can cause dangerous fires to the household and the entire community. Oxygen is one of the Class A medical supply items that should only be used after proper prescription by qualified medical personnel, and its use should at all times be monitored and regulated by a trained health worker. We'll now move to COVID-19 vaccination and commencement of the second dose. Uganda received an additional 175,200 doses of the AstraZeneca COVID-19 vaccine from the COVAX facility on the 16th of June 2021. These doses were received under a dose-sharing arrangement from the Republic of France. This additional boost is to ensure that all health workers and those eligible for their second dose of the vaccine get vaccinated. Vaccination commenced on Monday, 28th June 2021 at selected vaccination points in the country. To date, a total of 861,645 people have received the first dose of the AstraZeneca vaccine, while 129,259 people have received their second dose of the vaccine. This means we have vaccinated over 1 million people. Update on the expected procurement and distribution of COVID-19 vaccines. Uganda will access the more COVID-19 vaccines as follows. A total of 285,600 vaccines is expected this month under the dose sharing arrangement through the COVAX facility. This will further boost our vaccination program. The fourth consignment of AstraZeneca vaccine from the COVAX facility of 688,800 doses is expected to be delivered in August 2021. A donation of 300,000 doses of the Sinovac vaccine from the People's Republic of China is expected this month, July. The Ministry of Health has concluded the initial legal requirements to procure 2 million doses of the Johnson & Johnson vaccine through the Afri-Exim Bank and the African Union, and the process is ongoing to conclude. Legal requirements to procure 9 million doses of vaccines through the COVAX facility under the cost-sharing framework have been concluded, and funds have been remitted for this. So we await a feedback on when we can receive the 9 million doses from the COVAX facility. The Ministry of Health is also at different stages of engagement to acquire vaccines from Cuba, Russia, China, and the United Kingdom besides the COVAX facility. I'll now talk about breakthrough infections following vaccination. The Ministry of Health, as part of monitoring of the vaccine efficacy, is collecting information on infections that may occur in vaccinated people. A team of experts analyzed data of hospitalized COVID-19 cases in Mulago and Entebbe hospitals from the 15th to the 21st of June 2021 to understand the effect of the COVID-19 vaccination on the outcomes of patients with COVID-19. The team investigated data from 200 patients in the current wave, and it showed that 11 patients out of the 200 had received at least one dose of the AstraZeneca vaccine, and the majority, that is 189, had not received any vaccination by the time of admission. Preliminary investigations showed that no hospitalized persons were fully vaccinated at the time of illness. Therefore, there is no current evidence to support the allegations that fully vaccinated persons have acquired severe infection and died in Uganda. This study is still continuing. Management of COVID-19 patients in private health facilities. With the increasing numbers of severe and critically ill patients, there is a strain on bed availability in all the public treatment facilities. The public treatment facilities are full, and therefore patients end up in private facilities. The Ministry of Health has engaged the owners of the private health facilities and reviewed the cost drivers of treatment in order to reduce the costs. The following resolutions were arrived at. 1, the private health facilities should adhere to the COVID-19 treatment guidelines provided by the Ministry of Health. 2, regular quality assurance audits will be carried out by the Uganda Medical Dental Practitioners Council and Ministry of Health in conjunction with the private sector. And 3, government will explore the possibilities of supporting supply of oxygen to the private sector. In conclusion, I would like to appeal to all those who test positive for COVID-19 to stop interacting with people within their households and beyond, even if they are asymptomatic. We request that they go into self-isolation and follow advice from health workers and start on treatment immediately if it is prescribed by a medical practitioner. However, if you have symptoms, ensure that you get linked to care in a timely manner. Remember, COVID-19 is preventable. Let us observe the standard operating procedures, respect the 42-day lockdown, and stay safe. Be vigilant, protect yourself and your loved ones. For God and my country.
Thank you very much, the Honourable Minister, Dr. Jane Ruth Acheng, for that very elaborate statement that you've given to us. Now, there will be a few questions coming in from members of the press who are with me here, and I request that when I call upon them to come and ask questions or making observations, we'll have to share this microphone here. But just before members of the press come in, a few things here to talk to us about. Dr. Tegeny, help us understand. We are looking at a continent over 1.3 billion people, and just about 1% of those have been vaccinated. Now, as we also grapple with the Delta variant, we are being told that vaccination is one of the ways to go. And so looking at a country like Uganda, for example, when we have just about a million people who have been vaccinated and not fully vaccinated, we want to know what the fate here could be, and to also help us understand what you in public health call the vaccine hesitancy. Because I think that's also the other issue. The vaccine hesitancy comes because of the different types. And so many people asking why the COVAX facility is only possibly giving us AstraZeneca and not what is happening elsewhere. We need to know that. Then too, I think Dr. Cheng and the scientists here will also help us understand what you, the scientists, now call the happy hypoxia. We want to know how it also weighs on the symptoms of COVID-19 and how fatal it also is. The happy hypoxia, a bit of it. Another question here is coming in from Ivan Kahwa, and it is to all of you. He says he wants to know the minister to clarify on the quarantine centers, because we used to have those. And the other question here is on contact tracing. But to maybe just throw a light on this, the last time we had this infection here, or during the first phase, we were told that about 8 to 10 interactions could be affected by one positive case. That number has grown to about 23 and 30 in the second wave for every positive case. We also need to know whether contact tracing is still possible in this particular era as we grapple with this. And then maybe another question from the public here is about the exorbitant costs of treatment by the private facilities. Yes, Honorable Minister, you've talked about these 3 resolutions, but also requested, because the Executive Director of the Uganda Healthcare Federation, Grace Salichiwankaizia, I think she also help us understand why private facilities are charging exorbitantly. I will now request members of the press who are here, and you have a question or two, to the Minister and the scientists here, before I let them respond, and before we close this down. Anybody with a question? Yes, come tell us your name, your media house that you're representing, and I think it just would be good to make the question short, and if possible, one question would be good for all of us. Welcome.
Thank you. My name is Edward. Thank you. My name is Edward Muhumza. I work for NTV. Please allow me have 2 questions because I had. Okay, thank you. Honorable Minister, my first question is: you've mentioned the list, the plans of acquiring more vaccines, but perhaps we need clarification on the information going on, especially about these vaccines across the globe. You've mentioned one of them is from Sinovac, China, and you have these, tabloids writing that there are certain vaccines, including AstraZeneca, where people who have taken those jabs won't be recognized as vaccinated. For example, in the US. So what is the future of someone in Uganda who is preparing to take that vaccine? Secondly, I'll speak as someone who has contracted COVID-19 and went to medical facilities. You talked about someone getting COVID-19 and not panicking, seeking medical help as soon as possible. But is that medical help there? I've been to hospitals and I felt as though I'm being ostracized by a doctor who is supposed to give me hope of healing. And I think this is going on in many facilities. So what is the capacity in these hospitals to mentally prepare these people who have contracted COVID-19 to know that they can actually heal, instead of being ostracized to think, because I was treated at some point as a leper? I hope I'm clear. Thank you.
Thank you, Muhumza from NTV. We really thank you very much. Another question here has come in from the public, and they quote you, Honorable Dr. General Acheng. Regulations of private facilities managing COVID-19 patients will be done by Uganda Medical and Dental Practitioners Council and the Ministry of Health. Reads Dr. General Acheng. And the question is, why is the Nurses and Midwives Council not left out of this regulation? In a way, this question could come possibly from somebody who is practicing as a nurse or a midwife. Thank you, Muhumza. Any other question? Any other person with a question out there? Yes, Walter.
Thank you very much. First of all, we would like to hear your take as Ministry of Health on the natural remedies that are being developed here. We have Covidex that was notified by NDA, but also we know that our own people at Mulago were developing plasma to be used. Those studies were still underway. Also, and the one the President launched the other day. Would like to have an update of what's happening there. We've also seen a document signed by you, Dr. Cheng, on the prohibition of entry of anyone coming from India until the 30th of July. We would like to know the reasons why. Also, Uganda has been red listed, by some countries out there. And we want to know why Uganda is being red listed. Because what we see from statistics here is that the numbers are going down, and the test positivity rate has come down from about 21 to now 14 as of yesterday at least. Why are we still red listed? And okay, I'll ask the rest later. Thank you.
Thank you very much, Walter Mwesige from NTV. Any other person with a question out there? I don't know whether Aineviona here has some questions from social media or coming in through. But the other issue, Dr. Cheng, that I also would love you to respond to is the psychosocial therapy to the frontline workers. Because when you look at what is happening in our different CTUs across the country, you notice that the number or the ratio of patients to a nurse or an attendant is also overwhelming, and these people seem to be working for several hours. We also need to know how you will manage this, the psychosocial therapy of frontline workers who also seem to be grappling with this. Emma, come and read a few of those questions that you have, and I will let the minister and the others respond.
Thank you very much. There are some few questions that have come through our official social media channels. One is asking, why are fully vaccinated people falling sick due to COVID and some even dying? Do we need to check before getting vaccinated, to test before getting vaccinated? Another question is, if I have recovered from COVID-19 2 weeks ago, can I get my second shot of the vaccine? Will the second dose be effective when it takes more than 13 weeks without receiving it? Does the vaccine react to any other medications? If yes, which medicines? Now that children below 18 years are also getting infected and actually dying during this wave, will children get vaccinated? Is it true that the vaccine has magnetic elements as recited by clips making rounds on social media? There's one from Nicholas Mwanje, says, thank you, Ministry of Health. Please provide an update on the government plan and the commitment to procure PPEs for health work protection and also relieve the private sector. What quantities are in the pipeline? Thank you. Those are the questions coming from online.
Well, thank you very much, Emma, from the Ministry of Health. Dr. Jane Ruther Cheng, I will now request that I think Dr. Wayengera is here. He would help me apportion these questions. But before Dr. Wayengera comes on, I have, I think, another last round of questions as Dr. Misach prepares to apportion the questions to those who will respond to them. You're welcome.
Zahara Namali is my name. Two questions. One, we are seeing so many health workers dying due to COVID-19. Some are aged, and there are requests from the public. Is there something the ministry can do to maybe regulate or advise on which health workers can go in, so some of them to remain home, because we are ending up losing key medics? Secondly, on the public health control of COVID-19 rules, a document that has just been released to the public, there are several penalties that have been included when you're found driving without a permit, without your facial mask on, escaping from quarantine centers. What drove the 2 months penalty, and when does this start? Then I was also looking at the issue of burying. People are spending quite huge sums of money to send off their loved ones. When the body is put in that black I don't know the name you've given to it, that black caviar.
Body bag.
What more does a family have to do that it can't do, that they have to hire people who are wearing the PPE, disinfecting everywhere, that they're ending up paying as much as 10 million shillings after spending hundreds of millions in hospitals treating a person? Then you have to incur 10 million and above for the person to be buried. I'd like you, Honorable Minister, to help us clarify, are these fees necessary? We are done crying with the cost of medication. Now we are going to begin crying because of the cost of burying our loved ones.
Thank you very much, Zahra. Dr. Misek, please come and help us. Tell us who can answer what question. Karibu.
Asante. Okay, we have several questions here that I think what I will do is I will answer some and then I will direct some to the experts that are here, and then the rest will go back to the Honorable Minister as well as the leadership of the Ministry of Health. Jagenda asked questions, several questions, including the issue of Africa having a population of 1.3 billion, and we only have, I think, 0.1% vaccinated. What is driving the Estance and the Delta WR, I think, and the issue of the efficacy of the vaccines in context of the Delta variant. WR, you will take on that. Happy hypoxia is a situation where normally what happens is that your brain, when, for example, you place your head in water, or somebody places a pillow over your nose and mouth, your brain senses levels of falling oxygen. And that process, when the blood levels of oxygen fall, is called hypoxia. Now, in the context of COVID-19, we have a scenario where oxygen levels may fall in a person, and unfortunately the brain does not send back messages to tell the person that, hey, you are suffocating. As a result of that, the responses that are supposed to issue from this falling blood oxygen saturation are not triggered, including gasping for air and breathing faster. So this scenario is what we call happy hypoxia, and it is why as one of the important gadgets that we recommend for home care, people having a pulse oximeter to be able to measure the oxygen levels in their blood. The levels below 92, as the Honorable Minister has indicated, should translate into visiting a hospital. There was a third question on the issue of quarantine centers, contact tracing. Why aren't we doing that now? I think previously we labored to explain that the pandemic has phases, and we came through the point when we had imported cases. And at that time, we were running after people that were coming into the country, the truck drivers, the people from the airports. The strategies change. We moved to the sporadic cases. Essentially, where we are is a point of widespread community transmission. And the strategies change in the sense that at one point, the concept of contact tracing and isolating people by quarantine becomes essentially very difficult to do because you have so many people infected. It is very resource intensive and would be essentially impossible to have everybody quarantined. The Honorable Minister will answer the question of why overcharge, and I think she has probably talked about that briefly, why the private sector is overcharging and the mechanisms that are in place to ensure that some of that is resolved. Edward Muhumuza asked about the plans for sharing plans for acquiring vaccines. I will leave the WR to talk about the issue of why the EU and the US legislators are not recognizing some of the vaccines. What capacity to educate Ugandans? We have a robust community engagement framework that, of course, is just briefly in the offing, and many things are being worked out as part of the activities that we are supposed to do during this lockdown, including, of course, activating the local governments, the district task forces, the village health teams, and making sure that information reaches the people. There was a question about the regulation, and I think this was an oversight on our part. This regulation actually is not only about Uganda Medical and Dental Practitioners Association. Other associations will also be involved, including the Nurses Association and the Association for the Pharmacists. Walter Mwesigwa asked about the natural remedies. We previously issued a press statement on the clinical trial that was done for convalescent plasma, and we didn't find that convalescent plasma is beneficial, and this was consistent to the studies that have been done elsewhere, and so we have not adapted that as a routine approach. About the natural remedies, Covidex, the Covidex is still undergoing clinical testing. What the NDA did was to give emergency use licensure. But what I will briefly tell you is that berberine, which is the biggest content in Covidex, is an isoquinolone alkaloid, which has been previously demonstrated to have immune modulating abilities, including, of course, reducing the inflammation in the lungs. There are studies from China that indicate that it could have antiviral effects. But again, too early for us to say. We will wait for the studies to come out. Why are we being red listed? WR, I think I will again bring you to this. But one thing I will say is that the falling numbers that we have experienced more recently is not really a true thing. We think it's an artifact, largely because we introduced antigen RDTs. And at the time we introduced antigen RDTs, we had not fully adapted our RDS, or the result data system, to be able to capture the antigen tests. So we probably experienced a drop in numbers because we were not capturing the antigen test results, and I think that's being worked on. So we should not take that as a true picture of what's happening. The issue of psychotherapy for frontline workers, we have an occupational therapy strategy for the health workers, largely aimed at reducing infection prevention control. And among some of the things, of course, that the health workers do is support each other. And we have teams that essentially visit these health workers. We've had epidemiologists investigate cases of infection among health workers with the idea to find out what exactly probably happened. so that we are able to mitigate it. Professor, why are fully vaccinated people getting infected? I will throw this back to you. Although in the statement the minister highlights some of these things. Do we need to test before we vaccinate? Somebody got recovered 2 weeks ago. Can they get their vaccine? Suppose if somebody is ready for the vaccine and it takes more than 12 weeks to receive the vaccine, will the second dose still be useful? Are there any reactions with other medications from the vaccine? Is it true about the magnetic effects? I think just briefly to tell you that people need to appreciate that when we develop vaccines, the vaccine, beyond having a component of the bug which is not infectious, we design the vaccine in such a manner that we also add in what we call adjuvants. And the commonest adjuvant that is used to stimulate the immune system is aluminium oxide, which is a metal. So it is not surprising that some of these effects could potentially be experienced, but I think I will leave several of these things to Professor Serwada to address. The issue of penalties, I think this is largely Attorney General, but Honorable Minister, you could speak about it. And the barrier procedures, the Honorable Minister has clarified in the statement, but again, Honorable Minister, I think you need to clarify further. Thank you so much.
Thank you, Dr. Misaki. WR takes on first. WR.
Thank you. First of all, the good news is that AstraZeneca, the vaccine which we are taking, the Johnson & Johnson and Pfizer, are very efficient in preventing severe diseases and death. Some of the studies when these vaccines were listed were in a clinical trial settings. And we have observed, for example, in preventing mild and asymptomatic cases, AstraZeneca is not as efficient as the Pfizer or Moderna the vaccines. But in terms of preventing severe diseases and death, it approaches almost 100%. So I think that is one thing we wanted the public to know. All the vaccines are efficient for almost all the variants we have here to the level of preventing severe diseases and death. And I think that's very important point the public has to know. So, but at the same time, we have to be aware when the person's immunity is at full strength. This is not after the first dose, but it is usually 2 weeks and above from after the second dose. So after the second dose, 2 weeks after that, one can expect such protection from the vaccines we are using. And I think I covered the part about the Delta variant being sensitive to AstraZeneca, Johnson & Johnson, and Pfizer at a very high level of effectiveness, so a very high level of protection. The other question is about vaccine supply. As you know, the vaccine supply is not as ideal as we would have liked it. We have been promoting vaccine equity and fair distribution and use of vaccines. That brought the whole issue of that we were hoping by the end of this year, 20% of each and every nation would have been fully vaccinated. We are still hoping that. That was jeopardized because of two factors. One is certain countries facing a high incidence in their country, like India, having export limitation. And the other is hoarding. Countries have, even before the vaccines were started being produced, a lot of countries have pre-ordered, paid, and they have under their stock or under their right a lot of vaccines. There are nations which may have 5 million population and yet has given order for 15 million people, because at the time they order, they were not aware of which vaccine will come first or which vaccine will be the most efficient one. And to address that, there is a WHO, COVAX, and others are asking these nations to dose share. For example, the 175,000 which we are just using comes from that dose sharing. And as you know, the G7 in their meeting has committed almost 1 billion doses of vaccines to be available through dose sharing. So that means our hope is getting up again. If you ask me, I was very worried 2 weeks ago. I'm less worried that in time we will get more vaccines. In addition to that, there is additional investment from COVAX and the factories to increase production capacity, and more vaccines are coming into the market as well. So those are the hopes we have for Africa. Yes, it is not fair for the world, the rest of the world, to reach 20, 30, even 70% of their population covered by vaccines fully protected, while African countries are receiving a single-digit proportion of their vulnerable population vaccinated. So we should all push for these countries to share their doses so that vaccine inequality is addressed. You also brought the issue of vaccine certificate by some of the countries. WHO does not promote vaccine certificates because they put people into a disadvantage for traveling. So although we understand some governments and some bodies will implement vaccine certificates, to do that, different countries have different procedures. The European Union has the procedure that they will, they have issued a vaccine certificate based on the vaccines they have analyzed. But in that analysis, they also mentioned, they recognized the emergency use licensing which was given by WHO, but left the implementation to the individual member states. And some member states have taken that in its literal meaning and has not included the COVAX facility approved AstraZeneca produced in Serum Institute of India or other vaccines into this. We are working with the European Union, our European office, and you might have seen a joint communique by COVAX partners, which has emphasized the need of mutual recognition of vaccine certificates. So we are working on that, and we hope in the next week or so this will be resolved. I think those are okay. Why are countries red listing Uganda? I think every country has its own analysis. For example, we said we have prior country category 1 and category 2 on our analysis. What COVID is putting is that not only every individual, not only every community, every nation to analyze its risks and decide on the risks. But the best way of resolving this issue is transparency and making your data available. So when another nation knows that you are transparent and you have your data, you have a reliable system, then they would rely on that data and then make sure that they accept or not. But this is a dynamic process, but also it also matters on developing a mutual trust and the solidarity. I think those are the major issues which were addressed, but if needed, I'll come on other issues.
Okay, thank you very much. Professor Seredde.
Thank you very much, listeners. There were several questions addressed to me, and I'll bear with going through them. The first question was, why are fully vaccinated people sick due to COVID? That is an impression that I also get to hear. But the minister has, in his report, status report, indicated a small study that was carried out on 200 people who are admitted. And it did find that actually there were no cases that are fully vaccinated hospitalized. Admittedly, it was a small study. And there were only 5% who had just one first dose. Now, a fully vaccinated person is really defined as an individual who has got 2 doses of the vaccine after 14 days of those 2 doses. Because the vaccine after the second dose takes some time, takes about 2 weeks to be fully impart the full benefit of the vaccination. Fully vaccinated people, breakthrough infection after fully vaccinated is very rare. And that is why actually there were no cases probably found. But they do occur, so they are there. And that is fairly true of any vaccine, because not all vaccines are 100% effective, and therefore, in this case, effective in preventing severe disease. So there's an expectation that there are going to be some very few people, very rare few people, who will be fully vaccinated and will have it. But still, it is much better to have a fully vaccinated and try to reduce the number of people who have a full-blown severe illnesses. And it is also still true that even if you have got your first dose, you still will have some protection. Not as much as a fully dose, but you're much better off as an individual who is actually not vaccinated. This is why in this study, only 5% of those who have had their first dose, not 20, not 30, are actually hospitalized. So we think that these are fairly, very efficacious vaccine to protect you against severe disease. The other question was that why is it that do we need to test, do we need to check for COVID-19 before we get a vaccine? We do not need to, and our rollout program does not need to take for anyone to take a COVID test before he or she gets vaccinated, and that is true of any vaccine program elsewhere in the world. And somebody also wanted to know if you have recovered from COVID-19 2 weeks ago, I think that was the question, can I get the second dose of the vaccine? When you have had a COVID infection, we usually recommend to wait. There are various recommendations, but we tend to recommend at least after 90 days from the COVID infection to get a second dose. Yes, you have to get a second dose, but because you still have antibodies from your first infection, the take of the vaccine immediately, if you take it immediately, may not be as strong. It may not give you as strong a reaction as when you wait several days or several weeks before you take a second dose. But you still need to have a second dose in order to be fully really covered. And the reason why you need a second dose is because the infection you have got, we are not too sure it has stimulated the body enough to give you a good boost of antibodies to protect you moving forward. So that's why we err on giving you a second dose to really stimulate the immune system to give you the full protection that you need. The other question is that do you need, if you second dose, can a second dose still be effective after 13 weeks? I think that was the question. 13 weeks, because we have always recommended we should give a second dose in the window between 8 and 12. The later the better, because we do know, especially studies that have come from UK, that the later, meaning towards 12 weeks, you get a much stronger immune response. But interestingly, 2 weeks ago, there was a study that was published, not very published, that showed that actually 14 to 15 weeks, you can even get a stronger immune response on your second boost. So yes, after 13, 14 weeks, you still can. Studies are still undergoing even how far out you can go. People have been immunized after 20 weeks, and they have shown very good immune response to the second boost. So please, if you have not within the 12 weeks, it's not late for you. In fact, I just read one study which immunized after 30 weeks, and they got a very good immune response. We don't know when, after how long you need to restart, but at the moment, we indicate that please get your second dose, irrespective of how far out you have been. I think those were the question of drug interaction. There was a question of vaccine and vaccine-drug interaction. This is a question that I actually personally get from time to time. What are the drug interactions between the say AstraZeneca and when you read out the insert of AstraZeneca, actually on the section of drug interaction, remember this is a vaccine that has just been licensed for use somewhere in December last year to January this year. So the full-blown interactions between the vaccine and others is not very well understood. And therefore, this is still observation that is in progress in trying to find the full range of interaction. However, always there are patients who are immunosuppressed. For example, they are on immunosuppressive treatment, and they always are they have been very reluctant about this COVID vaccine. But so far, we do not have any reasons why not to give people who are on immunosuppression to vaccines, to this AstraZeneca vaccine. So the full-blown extent of what are the drug interaction is not completely, fully well studied, but this is an ongoing experience. Suffice to say that probably at this point in time, we have not seen any serious drug interaction between AstraZeneca vaccine to warrant a contraindication. Thank you very much.
Thank you so much, Professor Serwadam.
So we'll have
yes.
Dr. Grace Salut talk about the
Grace will
private
come and talk
sector.
to us, and of course, thereafter, we'll also receive the Honorable Minister Kawoya here. But there's a question which is specifically to you, Honorable Kawoya. What will the Ministry of Health do to frontliners' families, whereby they are the breadwinners, and besides calling them heroes, they've also died on duty, and they just want to know whether there is any compensation package to their families and for their families. And this was a follow-up to you from the public here, to Professor Serwadam, still on the same, and somebody saying if they must travel to Europe, even after so many weeks after getting the second jab of Astra, can they go for another vaccine that is acceptable in Europe? That's if they must travel. So many weeks later, they had their second dose, and they now want to get either J&J or Pfizer or anything. Can they do that? Is it okay? Grace, please come and respond to the issues of the private health facilities here, and we'll also receive Minister Kawoya to talk to us before Minister Chen closes down.
Thank you very much for that question. I'd like to elaborate that. Thank you. Critical care was expensive, even before the pandemic, not only in Uganda, but across East Africa and worldwide, because of the nature of the care given in these units. The pandemic has amplified this, and even our sister federations in Kenya, Tanzania, and Rwanda, who, like Uganda Healthcare Federation, bring together the private sector, report the same challenge on these costs. What I'd also like to mention that now the core of our discussion with the Ministry of Health has been these cost drivers of the treatment that is being given. We've done analysis and found that up to almost 45% of these costs are driven by PPE, oxygen, and medications. This is being combined with the number of days admitted in ICU. Prior to the pandemic, on average, people were in ICU for between 3 to 7 days. But with the pandemic, we're seeing on average between 10 to 20 days. And so that is in itself driving up the cost. As the Honorable Minister highlighted, one intervention we've zoned in on with the Ministry of Health is support with free oxygen. We will continue to discuss with the Ministry ways in which we can continue to manage these costs. This is work in progress, but we'll continue to dialogue. Thank you.
Thank you, Grace. Well, thank you very much. Grace, the Executive Director of the Uganda Health Care Federation. Professor Sereda, respond to that before Minister Kawe comes in.
Oh, this is to do with the question, if you're fully vaccinated,
Yes.
say from Uganda with AstraZeneca,
Yes.
and then you go to
Many months
say
later,
Europe
you want to go to Europe.
and all the US, and you want to get another vaccine. I can tell you from personal experience, my wife tried to do the same thing. Actually, if you're fully vaccinated, say with AstraZeneca, you do not need to go and get a third vaccine from either Pfizer or Moderna. She was completely refused to get. You are fully vaccinated, you are good to go, you don't need to go to get another third, fourth. However, some people can mix. There are some studies now that have shown that if you had the first dose, that is AstraZeneca, and for some reason you want to get Pfizer or Moderna, you can actually do that on your second dose. There are studies that have shown AstraZeneca first, Pfizer second, you get a very good immune response. But the difference between those who get second and dose AstraZeneca, first and second AstraZeneca, and between those who get AstraZeneca and Pfizer, although there is a difference, it's not statistically different in terms of the overall immune response you get. So no, don't bother getting another dose if you're fully vaccinated. AstraZeneca works perfectly well, and it does induce a very good immune response. Thank you.
Thank you so much, Honorable Minister Kaweya.
Thank you so much, our listeners. And I would like to, first of all, appreciate my senior minister for having come out timely to update the nation, our listeners, about the update of the COVID-19. At the same time, I want to appreciate all our expert responses, which have been timely, and they have shared out. And I want to once again to appreciate our citizens, our communities, during this critical time that we are in as a country, especially at this second wave of COVID. Before I move on to one area which the minister will respond to, this is about the penalties. I'll also touch on it briefly. But to go to the question of, I do appreciate the person who has put up this question about the frontliners and what government or the ministry has
as compensation package, the families,
as a
for those who
compensation
died.
packet. We are all aware that under our labor laws, we have what is known as compensation package. So the ministry, working together with our other line ministries, that is the Ministry of Labor, Gender and
Social development.
social development, our Attorney General. This is very clearly spelled out. But we do appreciate that, again, it is under our ministry to work together to ensure that we harmonize and ensure that these who are affected get their due attention, and then their issues are addressed. That is what I can say. We have our compensation laws, the procedures that we go through. At the same time, there is a network. All ministries are under the same sectors. They work together, they do coordinate together to ensure that they look at such issues. And to the listener, they can go to our Minister of Gender and Labour, they can go to our Minister of Justice, they can come to us so that we give them guidance and how to go about it. One person asked, and I think is my sister, that the penalties. My take to that, listeners, most of this is really a misconception where most people think that is a punishment. These penalties are not punishments. In one way is to instill attitude change. That the moment that you know that if I don't do this, if I don't observe these SOPs, this will happen. Now, to ensure that this does not happen and I'm fined for it, I must do this. That is it. It's a way really to take you that if you say I'm supposed to drive on the right, and if I drive on the left, there will be a penalty. So what do? You have to drive on the right side of where you are supposed to drive. So listeners, these are not penalties. And in any way, from my practical experience, when you look at other countries, I've been traveling through some other countries. For example, when you go to our neighbor in Rwanda, there are penalties. In the United Arab Emirates countries, there are penalties. In Seychelles and Comoros, there are penalties. But you hardly get anybody penalized. They have taken it upon themselves to know that there must be attitude change. These penalties are for attitude change, nothing. The minister has said, our experts have said, yes, we are in a second wave. And this second wave have come up at this time. And I do want to appreciate our communities, our citizens. They are now appreciating that this COVID is for real, which was not in the first wave. Now, if it is for real, and they now are aware it can be managed and prevented. First time they did not know, they were saying it is not there. In these countries I have said, it is an obligation for every citizen to wear a mask. There is no policing. Everybody is the police of him or herself or the neighbor. What is this? Attitude change. That you can't walk out of your house without a mask. So why should you go to a market and you find policemen and women are beating you to wear a mask? Attitude change. And this is what we are emphasizing on as the ministry, as a government. Number two, awareness. Everybody now is aware that this COVID is there. It can be managed. In the minister's update statement, she has said, however, everybody is becoming a doctor. Yes, that is awareness. So everybody is trying to see how do we. But she has gone further to say, in this being a self-doctor, it's again dangerous. So that is another way where we should go and explain more. What I'm seeing again on this, the communities are aware and very much aware. Therefore, there is now a more move towards timely information, sharing and dissemination that is going back to each and every person. So to me is that these penalties are there just to say, if you don't drive on the right and you drive on the left, this is what will happen. So to avoid that, this is what we shall do. And all other these countries, they don't have policemen. They don't have anybody. Everyone, you get out of your home, there is a mask. Even when you are traveling on the streets in Komoro, you have to travel leaving that, keep the meter. You can't, if you overpass, you must overpass to ensure somebody is behind you. If you are following them, you must leave a distance. So I think we have to work so much and appreciate that there must be attitude change. Now, another issue I want to touch on briefly is the home-based care. Somebody asked about it. One of my facilities worked as an isolation center, and I would pass around for free. It was a nursing school. But a home-based care is better than taking a patient to the center. And the problem we have is the moment you are transferring all these community patients, then you are transmitting further on the way to the communities. So how do you manage it within a home? That is why it is better that you have a home-based center. And then this, an attitude, one of the person who asked and said he was a patient, but how was he cared for? Mental preparedness. You first have our task forces, district health, VHTs, to talk to the families so that they don't feel that they are really rejected. They are a society menace. No. They say reassure them, counsel them, at the same time, themselves they appreciate that we are here. And it is easy for data collection because you use those other people down to get correct timely data, you share out, you know how they are and monitoring. So all of this one we can say as a roundup that it is within our change of attitude, which at least we are seeing as a country and as a ministry. We have to continue with the monitoring, we have to continue creation of timely information, as well as the doctors have said and experts that these vaccines, we all know prevention is better than cure. So now, if they say vaccinate, it is better. And you say, even if I vaccinate, what happens next? But I'm very happy that the society, because my work has been more to do with the public. So I thank you so much, and listeners, I want to thank you so much, and I want to say we continue observing the SPOs, we adhere to all the directives. They say stay home for 42 days, then you'll see. So that is all that I could say, but I also want to condole with those ones that have lost their dear ones, but we can still prevent this disease from escalating.
Thank you so much, Honorable Minister. Now, this being a press conference, in a TV studio, we'll beg that we'll defy a little from the protocol that you normally follow. An interesting question here has come in from somebody who says, here, I think it is a he or she, has just seen Dr. Diana on screen. And the question to Dr. Diana, because they showed you, I think you were hiding it from them, but the camera showed you, and somebody says, I just saw Dr. Diana on screens here, and I need to know, I need an update on the risk allowance payment to the doctors. When they saw you, Dr. Twine, you need to respond to this because I think it is you who carries and moves around with the monies, maybe. And maybe finally, from me to you, Honorable Minister, which we'll end with. For as much as I remember, the government through Mbarara University of Science and Technology for the last about 5 or 6 years has trained a lot of critical care personnel. And I just want to know whether all these that we managed to train as a country into this fight, or some have been relegated now into politics, agriculture, and quite a number of things. We just need to know where they are because we now need them more than we possibly thought. Dr. Twine, somebody saw you on screen. Could you please just come and respond to the question of the allowances? And then the minister will, of course, speak to us finally, and we close this down. You're welcome, Dr. Twine.
Sorry. Thank you. The payment of risk allowance has been made and it is still continuing. This is a continuous process, so it's not an event. It is a continuous process. So we are continuing. to pay. Even those that have not yet received the one for June, it will come. So they shouldn't worry. Government does not cheat. It can only delay, but it does not cheat. So that's just an assurance. Our PRO asked me about to talk about that someone was asking him about the pickups, the donations, yes. We received about 29.6 billion in donations. I remember last time when we were here, we talked about it, but I'm assuming that people have forgotten. Let me repeat. About 29.6 billion was collected in donations, and of that, 23 billion went to purchase the pickups. As I talk now, half of the pickups procured are in the country. They are at Toyota. But we cannot pick only those. We have to wait until entire number of pickups are all here, registered, and released to us. The other money was supposed to do renovation, construction of blood bank in Soroti. Our engineers have gone ahead to do the site inspection. They have done the designs. Remember, this money came to us in April. It first went to consolidated account because that's how the legal requirement is. It goes to consolidated account, then we went to Parliament to get it through supplementary budget. Then it came back towards end of April. So when it came to us in end of April, we started procurement of those things that are supposed to be procured. And so one of those items, the pickups, which they had to ship from far. We don't manufacture cars here, so it took time. But the good news is that I think about more than half of the pickups already in the country, and we think that in 1 or 2 weeks, the delivery of all pickups will be here. They'll be registered and they'll be released to us. So we shouldn't worry. We shouldn't. There is no unnecessary unrest. No one has stolen that money. Then the other area was they were supposed to construct the houses at the border points. Remember that time when we had a problem of truck drivers, and our workers were hiring hotels for them. It was very, very expensive to keep them in hotels. So when there was this need and the private sector contributed to this, the decision was made that we do something tangible, permanent, that is not consumptive. Because if you put in test kit, if you put in other things, you use it and you'll not have something to remember about the contribution of the private sector. So because of that, that's why we chose to get something tangible. So one of them are the staff houses at the border points. We chose 2 border points. And the engagement started to secure land from the local government. Unfortunately, this process has taken so long as we are negotiating with the local government to identify for us a suitable place, because also the port health, to construct some infrastructure, the border is very important, because we don't build for today, we build also for tomorrow, even the subsequent epidemics. But also it is also our obligation as the regional country in the region, through the Joint Commission in the East Africa, we committed that we shall put infrastructure at the border points and put port health, proper functional port health. So this was in line with what was our plan. So when we delayed to get the land, and because of now the urgent need to expand bed capacity, and we have our isolation center in Entebbe, which we have completed, but we don't have staff houses. They are not there. So we made a decision that after all these are staff houses. And these are prefabricated houses. You lift and place them somewhere and immediately start using them. So today we are at the isolation center to see how ready we are, because we want to make sure that we are not taken by surprise. Should these numbers continue escalating, we need to have extra capacity. So therefore, some of those staff houses on one border point, we are going to reallocate them to the Entebbe Isolation Center so that immediately we have where our staff can be when they are taking care of COVID patients. And these are permanent structures, so still that will be a symbol and the remembrance of those private sector contributions. So it is. I just want to allay the anxiety of all Ugandans. You don't have to worry. You don't have to be, to think twice that the money was lost. No, it is not lost. So that's it. Thank you very much.
Thank you very much. Thank you very much, Dr. Trine. You've elaborated on that. We thank you so much for your indulgence. On our protocol breaches, Honorable Minister, please now come in, and in the next few minutes, we close this down, having heard from you.
Thank you very much, Mr. Jagenda. All the questions have been responded to, so I will only comment on probably two. We'll begin with the critical care personnel trained, and where are they? All these critical care personnel are with us. We must take note that we are not only responding to COVID, we also have essential services to provide. And so the health workers continue to provide essential services. There are many people that we have taken on contract to support the COVID response, and this recruitment continues, including some that are supported through the World Health Organization. There was a question about health worker infections and health workers dying due to COVID-19, and some are old. Allow me to state here very clearly that we have not lost any health worker from the isolation facilities. The health workers that we have lost have been health workers giving care to patients, but not in the isolation facilities. That only goes to tell you clearly that we are all vulnerable, especially the health workers giving care or giving essential services. And therefore, they also need to take care. And recently, the DG wrote a circular advising that health workers should double mask. And I do hope that they are following on this. Obviously, we only accept those who have been trained and retrained into the isolation facilities, and they continue to work in shifts. Regarding burials, I think I went through this very clearly in my statement, and previously we have clearly said that there is no more need to use burial teams to bury people who have succumbed to COVID, and therefore the population should not be spending resources on burial teams. Once a body is already in a burial bag, it is handed over to the families to bury safely. And the advice to the family is, do not open the body bag, do not open the coffin. And usually before bodies are put in body bags, if they are from the facilities, relatives are requested to go and confirm, and they witness a body being put into the body bag and confirm that it is their relative. And because we are only burying 20 people, there is no need to open if the relatives have confirmed. Even if there was a multitude, there is no need to open the body. For those who would like the services of the funeral homes, they are still free to use the services of the funeral homes. It is by choice. Now, we are also aware that there are people who may die from the communities, but are they confirmed to be COVID cases? That one we do not know, so I cannot comment on them. But if we are informed through the home-based care system, then guidance will be given accordingly, because we expect severe and critical cases to be in hospital. I think that does for the questions, and I want to thank Honorable Anifa for explaining very clearly the issue of the penalties, so I will not go through it. So allow me to thank the general population on your vigilance. My observation is that everybody has a mask, although some still have masks on their chins. Please put on your mask properly. COVID is real. Try as much as possible to maintain your social distancing and wash your hands. These are the cheapest vaccines ever. The cheapest vaccines, without having to wait for a dose of AstraZeneca. You can social distance, wash your hands, and wear your mask properly. It is very protective. And again, please observe the 42 days lockdown to give us opportunity to assess the current resurgency and report to you accordingly on the impact that we have had during these 42 days, as we give space to the health workers to continue with the fight against COVID-19. Thank you very much, and God bless you.
Thank you very much, the Honorable Minister. Thank you very much, all of you panelists. Thank you so much, a team of experts that have been here. And of course, thank you so much, the fraternity of the media that has been here. And to everybody out there, let's just do what we've been told to do. My name is Jagenda Samakola Ziksoka, wishing a very blessed weekend. For God and my country, stay blessed, and good evening.
Fellow Ugandans, you know that the current COVID-19 period is a trying time in our lives. However, we still have another threat that has been with us for a long time, and it is called neglected tropical diseases, also known as NTDs. NTDs include bilharzia and worms that cause swollen stomachs. Trachoma causes blindness, and elephantiasis causes the swelling of legs. These diseases are affecting millions globally, and yet they can be prevented by regular hand washing with soap and clean running water, regular washing of the face with a soap and clean running water, keeping dirty hands away from your eyes, always using pit latrines, and discouraging open defecation in your community to avoid flies that carry germs, reporting to the health facility early when feeling unwell. Remember to stay safe and protect yourself. This message is from the Ministry of Health with support from Ascend Project.
Man, guess what happened yesterday? I entered the what? The taxi. But the pregnancy is from the what? The generator. Then my phone does tutu. And the toothbrush breaks in the what? In the porridge. Then I call who?
Wait, what?
First wait. I am still telling you. Then the jerrycan does what?
Love to talk? MTN My Paka Paka now has more minutes. Get My Paka Paka voice bundles to talk and talk at no extra charge. Dial *160*1# to activate My Paka Paka.
Everywhere you go, MTN.